All right. Well, thank you so much for joining us, folks. Welcome to our open house for the National Alliance for Rural Health Improvement, or NARHI, as we've collectively been calling it. My name is Kim Workmeister. I'm thrilled that you all are here, and I'm happy to give you a little showcase around our this little area of rural health that we have come to create. If you can go to the next slide, just do a quick introduction. So, as I said, I'm Kim Workmeister. I'm the Senior Vice President for Improvement and Implementation at Convergence Health. Convergence is providing operational support for the National Alliance for Rural Health Improvement. I'm joined by my colleague, Jennifer Wagner, who's the Director of Rural Health Initiatives here, too. So, between the two of us, we're going to be the main points of contact, but the primary point of contact is going to be Jennifer here, too. So if you can go to the next slide, I just want to give just a little bit of an introduction to what it is that we are building here, and what we kind of went behind the reasons for this, and what it is that we are seeing for the future with this. And then I'm going to turn it over to Jennifer to walk you through a little bit more about this. So first and foremost, the NARHI was born from rural challenges and is built for rural solutions. It's built by folks who have been in the trenches in rural health, have seen the challenges that are there, seen a lot of great solutions, and yet not really seeing a home for quality improvement professionals across the entire continuum of care in rural health. There are phenomenal organizations that are advocacy organizations for rural health. We have talked with all of them to ensure that they understand that we're all in this together. We see ourselves as a complement, not a competitor for any of the other rural health organizations that are out there. Rather, we just wanted to help to fill a gap that we see when it comes to quality improvement across the continuum of care. There are, in addition to all of these great rural organizations that focus primarily on advocacy, there are some fantastic quality improvement organizations out there, but they tend to focus more on the larger picture. There really wasn't anything that we could find out there in that sweet spot of rural health and rural quality improvement. So that's why we've decided to embark on this journey here with NARHI. We are going to be offering all kinds of benefits for our members. I'm excited to have Jennifer walk you through so many of those, but truly, we really just want this to be a home for folks, whether you come from a rural hospital, rural nursing facility, rural EMS, rural pharmacy, rural clinics. Does not matter. Anything rural, we want to make sure that you know that you are welcome here. This is a home for you. We have lots of ways that we're going to be sharing how you'll be able to communicate and collaborate back and forth with peers across the continuum and across the country. We have an incredible steering committee too. If you are a member of our steering committee and you're here, I see a few of them. Please go ahead and put your name and say hello in the chat box so folks can see kind of the depth and breadth of the folks that are helping us to lead this endeavor here. So with that, I'm going to turn it over to Jennifer to walk us through the rest of what we have so you can get a feel for this little house that we've built here.
Thank you so much, Kim. I am so incredibly excited to share with you guys the National Alliance for Rural Health Improvement. This very much is a passion project and very close to my heart and background, having been working in Montana and being born and raised here and working with our critical access hospitals here. And so we put a lot of thought in how we wanted this organization to support our rural healthcare workforce. So our goal is really for every rural community to have not only high access to high quality care, but that those delivering that care, that are delivering the support, feel connected, supported, and empowered. And so through NARHI, we plan to do this through empowerment, collaboration, and innovation with a growth mindset. So we will equip our rural health professionals with tools, knowledge, and confidence to lead and thrive in your roles. We want to foster meaningful relationships across really diverse rural settings. So we want to foster networks that span communities, disciplines, and facility types. And then we're always going to be seeking out to share creative and practical solutions that are tailored to the new unique challenges that you face in rural. And we commit to continuously learn and evolve and stay responsive to the changing needs of rural professionals and the communities that you serve. Kim mentioned that we have an incredible steering committee, which we do every day. I'm like, how did we get so incredibly lucky? And we really pride ourselves on being for rural by rural. That is a core value of the work we do, that we're always involving those that the work is for and involves. Um, and so this is also why we have a steering committee that guides what we do. And this steering committee is made up of passionate rural health advocates, professionals, and providers. And our steering committee provides direction on our content design and services. And as you can see from the map, we are all over the country and well represented from our rural states. I just wanted to also give a shout out to those that are on the steering committee and show you their names and the breadth of experience that they have helping build this platform and this organization for you all. So thank you all. I know they're introducing themselves in the chat. So again, we just really appreciate our steering committee so much. And so let's get into what we are doing here at the National Alliance for Rural Health Improvement. So we believe that bringing people together is really essential for driving improvement and change. And in rural health, we see continually that our strength lies in shared wisdom. So that's learning from each other. And this is how we really build lasting change and change that is resilient. So we have created a couple spaces where we want to support learning and connection. And I'm going to start with our knowledge network. So we're going to hold a knowledge network the second Thursday of every month at 12 p.m. Central. This is a monthly education webinar designed with our members in mind, responsive to what your needs and interests are. So we are going to be offering continuing education credits and focus on those topics that matter most to you in rural health. So we'll share in a couple of slides what we have coming up in the next few months, but I'm really excited about the content and where we can go and how we can shape rural health across all organizations. But learning is just part of the equation. We also know that we see real change when people come together to share and collaborate. And that's where our Confluence Live comes in. And so each month we're going to have live networking sessions that bring the whole community together. We'll provide some timely updates on any rural health news, some bite-sized education segments, and then having a space for open discussion, sharing, and collaboration. And this is really your space as members for our membership to connect, to contribute, to grow. And so we're very excited to be hosting those as well. In addition to our live events, we also have a member portal that we are really growing every day. And so the portal is designed to fit into your busy schedules, your diverse roles, so that you can get access to resources when you need them. It's really a living space for you. So on demand, we have first our Confluence community, and this is your space to connect. You can share files, ask questions, and collaborate with peers across the membership and across the whole country. So it's a real place for real-time support and idea exchange. And then we have education hubs. And these are topic-specific centers that have tools and resources around these key topics in rural healthcare improvement. Right now, if you were to become a member and log on, you'll find a hub on quality infrastructure. And then coming soon, we're developing a hub on hospital quality data reporting. And as we grow, we will be continue to adding these really specific education hubs that help provide the support you need right now. We are also hosting professional development collaboratives. These are designed for rural health professionals to grow, achieve certifications, and really support your own individual professional development and career. Our first collaborative is going to be to support preparation for the Certified Professional Healthcare Quality or CPHQ certification. And then we are also looking into Certified Professional in Patient Safety and some project management. These collaboratives are included in your membership, and so just in that is an incredible value compared to if you were to go find this type of education or this type of support independently. And then our tools and resources, or our toolbox, is a curated collection of guides, templates, toolkits, and evidence-based materials that are designed to support your work. We have the ability and encourage sharing among members of the Alliance. So if you have something you're really proud of and you did and you want to share it with others, we will upload that so that we can push that breadth of or the spread of innovation and change throughout the country. And then our educational learning collaboratives, these are a little bit different than professional development collaboratives, and they're coming in the future. We don't have those set up yet, but these are going to be structured, goal-driven work groups that work through things like quality improvement basics, quality improvement project. And so we'll be developing those as we continue to grow. And as I mentioned, we're going to be having content and features that are regularly added based on your feedback. Next, I want to share a quick video tour of our platform. Our marketing guru, Sam Simpson, put this together, and it's really great. And I'll show you what you'll see when you enter the NARHI platform.
Alliance for Rural Health and NARHI Community Member Platform, your professional hub for rural health improvement. Let's look inside the platform. When you log in, you'll land on your dashboard, which is your starting point to access resources, connect with peers, and stay up to date with everything happening. Along the navigation bar, you'll see different workspaces. These are topic-specific areas where you can find resources and collaborate. For example, the Rural Health Conference workspace is where we will share weekly rural health news and updates from across the country. We'll also be hosting monthly CE webinars and educational sessions, which you'll be able to access directly through the platform. Recordings and related materials are stored here as well, so never miss out. Check out the event calendar frequently so you can see all of the updated events that we are hosting in the NARHI community. One of the highlights of joining this NARHI community Toolbox, a growing library of templates, case studies, peer-shared resources, and so much more. This is where you'll find practical tools you can use right away in your organization. NARHI is all about collaboration. The discussion board is your space to connect with other rural health improvement professionals, ask questions, share ideas, and learn from peers who understand your challenges. Don't forget to check out your account settings. Here you can update your profile, manage your membership details, and adjust your email notification preference. Each workspace allows you to set how often you'd like to be notified, whether it's instantly, daily, weekly, or not at all. This way, you can be informed about what matters most to you without getting overwhelmed. The NARHI platform was built for rural health professionals like you. It's your space to access resources, grow your knowledge, and be part of a nationwide community working together to strengthen rural health. We're so glad you're here, and welcome to the National Alliance for Rural Health Improvement Community Member Platform.
So I hope you enjoyed our quick little tour. And just for, like we mentioned, the National Alliance for Rural Health Improvement is a membership-based resources. Our individual memberships are only $99 for a year, which is actually less than one webinar if you were to go purchase a webinar on just on public platforms. We are offering a founder's rate of $49 for the first 500 members for the first year. And within this membership, you receive the access to exclusive resources, continuing education opportunities. I mean, we'll have 12 of those a year, networking and peer support across the country. The opportunity to learn collaboratively and support your professional development. And we, like Kim mentioned, we are not in competition with other organizations. We are complementary to them. And so we want to raise all boats. We want to share what others are doing. So you'll receive updated information from other rural health organizations. And also one of our goals is that this organization can be resilient through changes that we see coming in federal funding, changes in regulations, there's always a home for you. And so I wanted to first share what we have on our calendar. We mentioned those live events. And then, so in October, we are going to have a knowledge network on October 23rd. This is normally our Confluence Live, but we wanted to kick off really strong with education. And this topic in October is going to be the team model for rural hospitals. And what's really incredible about this is that our team at Convergence has done a lot of work and has identified strategies that are going to help hospitals, whether or not they are in that team model. So it's really a great resource for everybody to help improve quality and lower costs. And then in November, I'm going to be presenting on quality infrastructure. And now this has been a historically critical access hospital focused topic. And it's reflective of the quality infrastructure that is set up through the FLEX program for critical access hospitals. But we're going to talk about how those are such key tenants and key ways we can identify and grow quality across all rural settings. So we're going to take that framework and we're going to talk about applying it across the whole of our rural health continuum. And then in December, we are going to have a guest speaker, Caleb Sang. You probably know him very well from the national, from the center. I'm going to get the full name, butcher it when I put on the spot, but from this rural center. He's going to be talking to us about strategic planning. He's an incredible resource. And then in January, Stroudwater is going to be talking about revenue cycle basics for quality. So we are really intent on involving, not always having to be the subject matter expert, but being able to connect people to those that are doing incredible work in the field. Some topics that we have coming up for our knowledge network is we are working with one of the physicians involved in the obstetric readiness program for AIM, the Alliance for Innovation in Maternal Health, on rural obstetric readiness. We have a patient experience expert lined up. We're going to talk about survey readiness and patient and family engagement. So we are building in these topics that we'll have in upcoming months. And again, these are all pieces that we want to hear from others on what is most needed. And then for professional development, Kim mentioned expanding from CPHQ in the next round, looking at the CPPS and project management as well. And then we are developing hubs for hospital quality data. I will make a note that I know that rural health clinics have a lot of quality data they have to report also, and that is going to be kind of our next quality data hub. We just need to hear what is needed. I am not one to assume or to think I know everything. So those of you in the rural health clinic world, please let us know what is going to help you make your quality data more efficient, make it more understandable. And then also hubs, Kim has a wonderful root cause analysis toolkit. We'll be putting that together, some survey readiness, QAPI, and quality. So those are kind of examples of those topic specific hubs that we can have available for everyone across that rural health provider continuum.
I did want to mention too, so for the learning session coming up on the team model for rural hospitals in next month. Is that next month or in 2 weeks? I think it's in 2 weeks. In 2 weeks, we are going to keep that one public because we do want to just still, let folks get an opportunity to take a look around, see, is this, are we providing the kind of information that would be helpful and valuable to you? So that one will still be public. And then following that, the sessions that we have starting in November, then those ones are going to be for members only. Yeah, oh, absolutely. If I cause a member and have affiliated rural health clinics, yes, yeah, we would be able to bundle those together if someone was purchasing group memberships for the CAW and their affiliated rural clinics. Absolutely, absolutely. And anyone that's interested in that, I know that our contact information will be on the following slide, and we'll send these out to everyone along with the recording. Please feel free to share this recording with anyone when we send it to you. If you are not following NARHI on LinkedIn, we have a separate LinkedIn page too from Convergence. That's where we're posting lots of information, not only about what we are doing, but we're also using that too as a way to spread information out there. We really do believe in the mission that we want to support rural health. There's, obviously a whole lot going on right now with rural health. There's a lot in flux. There's a lot in flux when it comes to funding. We know that the Rural Health Transformation Program funds are going to come out, but who knows exactly where those are going to be able to actually support the work of improvement that folks are doing. So we want to make sure that we have a way for folks to stay connected and to be able to get the kind of support that they need here too. And then if you're interested in joining us, we want you to join us. We think that the bigger network we have, the more valuable this is going to be for all of us. Every single, I believe I know almost every single person on the line today too, and I'm blown away at the depth and breadth of expertise here too. So if we just stayed this group of around 30 or so folks that were on here, that'd be amazing. But think of how amazing it would be if we got to my personal goal of 2,000 people all across the spectrum of care of rural health by the end of December. I mean, we can do a whole lot together as a large group. When we get enough voices here, we can actually become those advocates too. And my goal is to lift rural health as high as possible here too as a group. So would love to have you join us for that. So